Moving on, though, joining us now, we have a professor of history at Yale University, Timothy Snyder. He's author of the New York Times bestseller entitled On Tyranny, 20 Lessons from the 20th Century. And he's out now with the new book, Our Melody, Lessons in Liberty from a Hospital Diary. Why don't we start there, Timothy Snyder, your own personal experience with the healthcare system?
Well, my own personal experience with the healthcare system, I'm afraid, is like that of a lot of Americans with our healthcare system. Too many decisions are made not with the best interests of the patient in mind. We're allowed too late into hospitals. We're expelled too early. As a result of decisions like that, I nearly died. This is part of the basis for one of the reasons why so many of us have died during this pandemic. We have a system which is fundamentally not about the right of Americans to have health care, but which is fundamentally about the ability of people at the top of the system to make money. The pandemic has revealed this like so many other things.
So, Timothy, you say it was a near fatal illness that you write about in this book. And you're talking about a system here. You obviously acknowledge the greatness of our doctors and our nurses, which has been on display, particularly over the last 6 months. But what did you witness from your bed in terms of a system that needed repair, and how do we begin to do it?
Yeah, the book is divided up into lessons, and one of the lessons is actually put the doctors in charge. One of the most discouraging things about our system is that the doctors are totally disempowered. In fact, if patients realized just how disempowered the doctors are, we would really hesitate before going into the hospital. We're moving closer and closer to a world in which the doctors are basically just poster boys and girls for a medical system for profit. What I experienced was hardworking doctors, hardworking assistants, hardworking nurses, hardworking transporters who were rushed, who didn't have time, who had too much going on, who had to use a record-keeping system which is about profit rather than about information or exchange of information. What I experienced was a system in which every time a doctor or a nurse tried to do the right thing, they were pushing uphill. They always had to push uphill. And when you're pushing uphill, sometimes you don't make it, and sometimes a terrible thing happens.
So what are they pushing uphill against? I mean, to hear that a doctor can't make the decision in real time that he or she wants to make is disheartening, to put it mildly. But what are they pushing against? What's the resistance? If they know what they need to do, who's pushing back on the other side?
Yeah, I mean, young women and young men go to medical school for good reasons. They go to medical school because they want to keep people healthy and they want to keep people alive. However, when they're in hospitals, their time is managed in such a way that they have to see too many patients, and the reason for that is profit. When they're in hospitals, they face an incentive structure where they're supposed to perform procedures that can make money, and they have less time to do the things that will keep us healthy over the long run. Over the months and over the years, doctors unfortunately become discouraged. They become molded by the system. And that's one of the reasons, I think, why a centerpiece of a healthcare reform has to be one which is designed by doctors and which puts doctors back in charge. And that only makes sense when we start to think of patients as having rights, when we think of healthcare as a human right, as it is in so many other countries where people live longer than the United States.
So, Professor, in 2016, after the election of Donald Trump, you put a post out about 20 things, I believe it's 20 things that Americans should do to stand up to possibility of becoming autocratic leader. That, of course, turned into a book for you that was a bestseller, just a runaway bestseller. I think 65 weeks, the notes say here on the New York Times bestseller list. Obviously, you struck a chord. I'm curious, and it's an ongoing debate that we have, an ongoing discussion we have on this show about institutions. You say support institutions. I'm curious what your thoughts are 3 years later on how the institutions have held up, how the courts have held up, how the media has held up, and how the institutions of state have held up.
Yeah, this question of institutions is one reason why I wrote On Tyranny in the first place, because Americans had and still have an unfortunate tendency to think, aha, our institutions are good, they're going to protect us automatically. But the truth is that institutions are only as good as each of us. That's why one of the lessons of On Tyranny is to choose an institution and protect it. So our institutions have been as good as we have made them be. There's been terrific first-person reporting out of the national newspapers, but unfortunately, we've watched the local newspapers die. There has been terrific activism. The protests make a huge difference morally and politically. We need a lot more of that. There has been some recognition by Americans that we don't live in a place where authoritarianism is impossible. We need more recognition of that, especially between now and November. One of the points I tried to make in On Tyranny is that authoritarianism can sneak up on you. It's precisely when you think you're immune that you have the biggest problem. And because Americans do think we're immune, we're facing a much bigger crisis than we have to face.
We had Anne Applebaum on talking about what's happened in Poland, talking about what's happened in Hungary, obviously what's happened in Russia under the reign of Vladimir Putin. I'm curious how you compare our experiences with experiences in those countries. And let's focus, for instance, on the courts. If we get through these 4 years, and it's only 4 years, and we look back and say, well, American institutions on the whole held up. Is it our independent judiciary that just may be what's different about the United States as opposed to, say, Poland or Hungary or Russia?
I mean, first of all, I think if we get through these 4 years, our next thought has to be how to make things a whole lot better than they are now. Donald Trump didn't come out of a vacuum. When the Trump era comes to an end, what we'll need to be thinking about is how we can make things a lot better in healthcare and in freedom in general than they were in 2016. When it comes to the independent judiciary, what we're seeing is how important that is because, of course, it's under threat. One of the most important things that happened at the end of the Obama administration was that Mr. Obama was not allowed to appoint a Supreme Court justice when he had every right to do so. What we're now seeing is that if you pack the courts in a political way, you allow, in effect, minority rule. We're now in a strange situation where the party that runs the country is basically a party that's trying to stay in power by suppressing the vote and by controlling the courts. That brings us to the other examples you mentioned. That is how an authoritarian takeover happens. There doesn't have to be a dramatic moment. There doesn't have to be a revolution. There just has to be quiet progress in which the rules are exploited, the rules are bent, and finally the rules are broken. But now to December is the time when the rules are going to be broken, and now to December is the time when the courts and the police and everyone else is going to have to be loyal to the rules rather than loyal to the man.
The new book is Our Malady, Lessons in Liberty from a Hospital Diary. Tim Snyder, thank you very much for being on the show this morning.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.